Hi, my name is Sarah Bryant, and my focus for our capstone project is the University of Pittsburgh Medical Center, or UPMC, which is the company I currently work for. UPMC operates around 40 hospitals and some 800 outpatient sites and offers healthcare to areas in Western Pennsylvania and Central Pennsylvania, Maryland, New York, and even a few international locations like Croatia and Ireland. With its locations in Western and Central Pennsylvania, UPMC is the largest non-governmental employer with over 95,000 employees. This presentation will explore UPMC as well as propose a revision to career ladders to address the strategic issue of employee retention. But first, we'll look at the environment UPMC operates in, as well as define a few key areas of UPMC. First, UPMC operates in the nonprofit healthcare industry, which is a $1 trillion sector. Healthcare is the United States' largest industry, where spending in 2021 accounted for 18.3% of the GDP. National healthcare expenditure equated to $4.3 trillion in 2021, or $12,912 per person. Within this industry, hospitals are the largest submarket, accounting for 1/3 of healthcare spending and employment. Therefore, UPMC operates within the largest industry of the U.S. The size and scope of the healthcare is far-reaching and will continue to grow. CMS predicts the national health expenditures and GDP will grow approximately 5% over the next few years. The history of UPMC is altruistic, like most nonprofits, where it was founded by a wife of a Presbyterian minister, Lewis Lyle, in 1893. In 1986, 3 university-affiliated hospitals, Western Psychiatric Institute and Clinic, Presbyterian University Hospital, and Eye and Ear Hospital of Pittsburgh, unified under what we know today as UPMC. In 1990, the UPMC name originated as the hospitals continued to merge with other community and specialty hospitals, and then in 1997, UPMC added its insurance division. From its founding in 1893, UPMC mostly impacts Western PA, specifically Allegheny County, where UPMC maintained approximately 60% of the market share in 2022. The system of UPMC competes with other large systems such as Allegheny Health Network, Penn Highlands, and West Virginia University. Due to the similar structure of AHN and UPMC, AHN is UPMC's closest rival. However, AHN is operationally smaller than UPMC, as it claims 14 hospitals, 22,000 employees, and over 250 locations to receive care. Similar to UPMC, it does serve surrounding communities such as New York and West Virginia, and also in Ohio, but with no international locations. Similar to UPMC, AHN and UPMC both declared $26 billion of operating revenue, with AHN having an operating margin of $440 million and UPMC having an operating margin of $238 million. The mission and values of UPMC is listed on the screen, but I'll make a few highlights. The mission is to serve our communities by providing outstanding patient care and shape tomorrow's healthcare system through clinical and technological innovation, research, and education. Its values focus on quality and safety, dignity and respect, caring and listening, responsibility, integrity, and excellence in innovation. To me, as an employee and even as a student, I do find the mission and vision to be a bit convoluted. Essentially, UPMC is trying to be the best by desiring national recognition and by serving communities with outstanding patient care while also impacting the healthcare system as a whole through innovation, research, and education. Being the best in care and research is a bit lofty. As our textbook explained, grandiose statements are not a strategy, but rather wishful thinking. Therefore, I do find the strategy of UPMC a bit wishful. Within UPMC, there are a few key players. As we mentioned, there are the competitors such as AHN. As a nonprofit, there are also government influence because the government influences the nonprofit with its funding through things like grants and also through insurance reimbursement with products like Medicare and Medicaid. Additionally, donors are also a key player for nonprofits as they donate funds and monies to the nonprofit hospitals. And moreover, employees, as we will continue to see throughout this presentation, are relevant to the nonprofit healthcare system as well. As I mentioned, donors are a key player for nonprofits, and we saw in 2022 that UPMC saw a decrease in donations by about $2 million overall. As such, we're seeing that nonprofits such as UPMC are having to look to other investments to try to raise capital for funding for its operations. And in line with 2022 financial losses, there were investment losses for UPMC, approximately $1 billion in losses. Additionally, hospitals, due to the continued effects of COVID-19 and also due to inflation, are seeing the trends of pricier labor and more expensive supplies. The labor, when hospitals are short-staffed, they still need to provide care for patients, so they're having to go to agencies or travel staffing agencies to try to cover these positions. They're having to pay a premium price for labor. Additionally, within the systems themselves, they are looking for ways to be creative in retention for employees. One of the trends in retention is to do a clinical ladder program. This is not necessarily a new trend, as clinical ladder programs were developed in the 1970s by Patricia Benner's novice to expert framework to address the nursing shortage at that time. The idea was to focus on retaining and recognizing talented nurses through the stages of novice, advanced, beginner, competent, proficient, and expert. UPMC has one of these clinical ladder programs, and it falls under the designation of the My Nursing Career. There are 7 different levels regarding title designation. For example, to progress to a senior professional staff nurse, you must have 2 years of experience as well as 2 contributions or 1 certification and 1 contribution. Unfortunately, in my own personal opinion, and then also in interviews that I conducted with other nurses, there's often an administrative burden assigned to trying to work your way through these types of contributions and certifications to receive a pay raise. As a result, I would actually argue that it's quite a detriment to the overall success. We'll also look at the performance of UPMC in regards to its 5 foundational pillars: people, service, quality, finance, and growth. Specific to growth, quality, and service, UPMC did fairly well within 2022. However, specific to the people pillar, UPMC invested over $300 million in support of its workforce in 2022. These funds went to focus on retention, recruitment, and building a workforce pipeline. They added programs like a UPMC travel staffing team, a new monthly loan repayment program, UPMC School of Nursing tuition loan forgiveness program, extra shift bonus incentives, and the My Nursing Career platform, which includes the clinical nurse ladder program that I spoke of. Yet, despite all these claims, UPMC's 2022 turnover rate averaged 19% overall throughout the system, and more than 30% turnover within the first year within the hospital division. The 19% of 95,000 employees comes out to 80,000 employees who are quitting within their first year or so of hire. Specific to the finance pillar, the operating income of the health service division declined $907 million versus the same period the prior year. UPMC cites this decline primarily as the result of the continued effect of COVID-19 on patient volumes, as well as cost growth due to employment, staffing, premium labor costs, and other operating expenses caused by the condition in the labor and supply markets. So as we can see, people are having a huge impact on the profitability of nonprofits like UPMC, particularly the wages that they're paying, as well as the premium that they're paying for people to support the hospitals. And we can see UPMC itself actually has quite an extensive turnover rate, with the 19% throughout the whole system, and then the more than 30% turnover within the first year for the health service division. As a result, not only does UPMC recognize that this is causing an issue amongst them, but the turnover costs for one nurse are estimated at approximately $70,000 to $90,000. If we use that hypothetical rate of $90,000 per nurse, and if we said that all of those 18,000 employees that were quitting within the first couple of years were nurses, that's approximately $1.6 billion of lost funds due to employee turnover. With a clinical nurse ladder program, the estimated cost of that program would be completely recouped if just as few as 21 nurses were retained within 1 year of the system. So if we improve the clinical nurse ladder program, I think the cost of employee retention could be greatly diminished. Therefore, my recommendation is to revise the clinical ladder programs within UPMC and reward nurses for the time in service plus activities they do in their daily work. For example, in surveys about clinical ladder programs, nurses were asking for easier guidelines, clearer communications on program requirements, reevaluation of degree requirements, and unsurprisingly, what these nurses wanted from this clinical ladder program was enhanced compensation. As a result, I really find that we need to discover a way to enhance employees' compensation without the hassle of other requirements and administrative issues. For example, if it's discouraging to join a committee or complete a project to achieve a raise. If I'm a floor nurse already working a 12-hour shift, at times often short-staffed, the idea of staying another hour to work on a project or to come in on my day off to join a committee meeting is quite the hassle. So what I'm proposing is that we instead focus on creating a clinical nurse ladder program that balances work-life balance. So CLP should reward employees for tasks they perform on a daily basis. Why not follow a nurse for how many IVs they've placed, how many call lights they answered, or how many medications they passed? These are just a few examples of a different approach we could take to the clinical ladder program. It would speak volumes to most nurses that I interviewed regarding this process that they would get a raise based on their time in service and not just their performance review, which only equates to about 3 to 4% a year for a raise. In conclusion, I found through my assessment that retention is really a detriment to the profit of UPMC, and therefore UPMC needs to improve its turnover and retention rate so that it can get its labor costs under control and continue to perform and gain more competitive advantage within the Allegheny County and surrounding areas. Thank you.